So today's session was supposed to be an introductory meet regarding the mentorship forum. So the idea was to get familiar with some of the key members who will be there, not all the faculty as of now. Uh, and what this mentorship forum was about. Vivek, can you mute yourself? Huh. So what this mentorship forum about, what was the purpose behind it, why we started, like that. So we have as of now two members with us, two faculty members. One is Dr. Vivek Bakshi. He is from the Ahmedabad, Gujarat. He works as a consultant and head critical care. We have Dr. Sonal Kaushika, who's supposed to be also from Gujarat, Ahmedabad. They are in the same city but hardly meet, and the two opposite ends of the city. And Sonal Kaushika is very much involved in the coordination in the academics of the mentorship forum. If you have any query regarding any technical difficulty, she will be there to answer things. But before that, I'll give you a 10-15 minutes presentation on why we started this mentorship forum. And the purpose was that what are the your expectations from the mentorship forum, what you want, how it can supplement your critical care learning which you already are having. So I think you will be able to see my screen. So just 10-15 minutes. Those who know me from before or those who don't know me, I am not very good at PPTs. So I rarely use PPTs in my sessions. But because this is the first one and this is something which we have already told but need to revise. So this is a PPT, not me generated. It's a combination of ours and converted by the AI. So what this mentorship forum was all about. So when we were starting or learning our fellowship in critical care or doing a fellowship in critical care in 2011 and 12, there were no Indian courses by NMC or any other organization, and so any other government body, I would say. It was neither MD nor DM nor DNB. The DM started somewhere around 2014, and then somebody else joined. Okay. So, and DNB started in 2019. The first batch came out in 2022. So this was the structure. Till that time, only what was there were some society courses like IDCCM and the FCCM by the CCF. Then there were edicts and there were certain foreign fellowships. And because of that, and because of that, there was no WhatsApp also at that time very much popular. So what happened at that time? There was no cross discussions among the people those who were doing critical care. So it was very scattered sort of thing. So this is something. So 15-20 years ago, patchy. Some people were training here, some people were training here, some were doing this particular amount of course, some were doing this amount. The courses were different, the curriculum sort of overlapping, but sort of different. And post-COVID, sudden shoot of the internet and the connectivity and Zoom, you see everybody is connected everywhere. So that has changed massively. But problem is the specialty has scaled. Now you have DNB, DM, MD, different courses worldwide, different fellowships are started. So the courses have evolved, but the mentorship has not evolved to that extent. Institute can take now 3, 4, 5, 6 candidates, but the teachers are still limited because they will develop with that pace only. So and also the working area means some are working in an ICU which has a RICMU facility, which is a CRRT facility. Some are working in a area where they don't have a sled, even they have simple HD which they can take care of. So this is one area. Some may be working in the transplant ICUs. Akshata, I also got something to have here. It's a mango shake. So like that. Now, secondly, diversity of the cases, like somebody working in the north, somebody working in the south. So north, you can have hypothermia more in common. In the south, you can have drowning more common. So this variety of cases are different. So somebody who got trained in the northern area may not get exposure to certain things which are done in different parts of the country or different parts of the world, I think. Thirdly, the problem is because whenever student joins or enrolls in a critical care or any other specialty, he has a or she has a slight hitch in asking something if he or she is not that much comfortable or extrovert sort of asking. So at times they feel that it's a silly question. How can I ask? That hitch always remains. So with that keep in mind, with that vision keep in mind, to bridge all the gaps, we came up with that mentorship. Already ESBICM was providing lectures, already there were live classes, and we were developing CMEs, but it was for everyone who is working in the critical care. Some of them had already passed the exam, some are not giving the exam, some are practicing critical care, like that. But specifically for those who are pursuing some sort of critical care course, for them we wanted to bridge the gap. So with that vision, we wanted that there should be a connectivity where everybody can come on a single platform. Those who are doing some sort of undergoing critical care training, there should be zero judgment. Whatever they feel, they can ask freely. Nobody is going to judge them. How can somebody don't know something? Maybe like somebody knows that how to write a dialysis note. They may be able to they may be very good to insert the dialysis catheter, but writing the order of dialysis at times they feel difficult. So this can happen. So the idea was that should be no judgment. Everybody can ask even the most advanced or the most silly question. Secondly, because all of them are students, those who are pursuing critical care. Maybe they are getting good salary at one place, maybe they are not getting good salary or triumphant at that place. So we wanted that this should be beyond the financial things. So as you know that on ESBICM, most of the thing till now, so everything was free, but because of sustainability, we start charging for our mechanical ventilation course. It's the MECVent course, some of you know, which is specially designed for those working in critical care and in emergency. So we have started the charging for that. That too, I think we are reasonable in that. If some of you interested, you can think of it. Last date is 27 June. Anyway, so we uh, so we want that cost should not be a factor for the students. So they may be in the under any fellowship, a private organization or a government organization, or in India or abroad. We'll keep it 100% free. It is something which we feel that we should be able to give to them or interact with them, or at the same time the young fellows have lots of energy and lots of learning things. So they teaches us also. The question they ask makes us to read more. So with that, we came up with this mentorship forum. But having said that, we need to have a set limitations that what should be the expectations of people who are in the mentorship forum. So what is not what it is not. It's not a replacement of a local teacher or guide. They are the best person. They're teaching you at the bedside. They're solving your doubts. So we cannot ever compare with them. But it's a network of peers, network of students, colleagues, those who are working, and ESBISM expert. Our faculty network will also join in 2-3 months in that. And we'll start in a gradual manner so that the faculty from different parts of the world also can join this mentorship forum. Then it is not for managing real case scenarios, like you are managing a patient and you ask whether we should do dialysis or not do the dialysis in the patient. No, that for that you have your own guide and teachers there. Maybe you can have make friends here who are frequently dealing with those cases. So you can call them and ask them. But once that case is done, we can have a discussion on that, what could have been done, or what you did correctly, or what we should learn, and in the next case it can benefit. It's not a forum to crack your exam. Like it's not there to means what you say, to clear your DNB exam or DM exam or fellowship exam. No, the purpose is not that. The purpose of this mentorship forum is to develop the concepts, to have a deep understanding of the subjects which you are studying. Practical points needs to cover, and ultimately it will indirectly help you to clear your exam. So it's a holistic support. We can help you in research and academics, reading the literature, how it should be read. Even if you have not only academics, if you feel that you are having a burnout, or at times you feel that maybe you have chosen a right path or right thing, or you have a conflict with your senior or a conflict with someone whom you want to have guidance, we can help you out in this discussion, because we have all gone through the same phase. Then also that it's an administrative thing also. At times we want, as an intensive care person, not only you need to manage the patient, you need to manage your staff, you need to manage your nursing, housekeeping, coordination with different specialities, with the medical superintendent and the quality team. So some guidance on how to deal with them, or how to manage them, how to best utilize this we can discuss. And finally, because we are doing the things, because we are connected with all lots of uh, your fellow candidates who are doing these fellowships and courses across the country and world, so we can have a validation that we are doing right, or what needs to be done, or you have a better exposure to that. So how we'll take this? So immediate connectivity is our WhatsApp group, and slowly I think over a period of few months, most probably in the September or August end, we'll move this to our inbuilt panel, which is member panel, which will come as an app, and we'll move that to there, so that there are certain limitation and restriction which we need to remove, and we need to insert that. Then we have a certain virtual sessions like this which we are having. We can have a dedicated um, dedicated live classes or something like that. And then in future we can have dedicated workshops, or 2-3 day conference specifically for those who are working or doing fellowships and courses. So eligibility, anyone, open, but the problem, the thing is, it should be, it is open to all those who are getting trained in any type of critical care course, whether in a small tier 2 cities, tier 1 cities, tier 3 cities, or maybe in India or abroad. Everywhere they can join. uh, I already said they must be pursuing a formal critical case. The near peer rule means that suppose you are about to join a course, or you have already finished a course. So if you are about to join a course, you have enrolled, your admission is confirmed. That means eventually you will pursue the course, so you can join this early. If you have immediately crossed the course, that means completed the course, means you are in a better position to guide the fellow candidates who are just below you. So we buffer that. So that will be always there. And also those who have cleared the fellowships, they can join a faculty network and can be a permanent part of this. So what are the mentors? So no mentorship forum. So who will be the mentors? So the first layer of mentorship is our ESBICM leadership. The ESBICM, the core people which started this ESBICMs, like I started ESBICM with some few like-minded people. Dr. Vivek is there, who is very much active in that. Dr. Sonal, who is there, Dr. Abhi, Dr. Benjamin, Dr. Gunjan, and many of the people are there behind the scene. Then we have members from different committees. So we have an academic committee, we have a scientific committee, we have scientific programs and event committee. So academic research and scientific programs and research committee. We are coming up with a medical legal committee also. So members of these committees will help you out. Third layer is our faculty network, which we have research faculty, educator faculty, and the next gen faculty. So these were the people who will be helping you out. So over a period of 2-3 months, we will gradually add these people to the forum so that they can help you out. So how you need to apply? Everybody, those who have done this, and we will make it simplified in the future. So you just need to fill a form, and then we will verify, and then we can connect. So bridge this gap. This is a ESBIC website thing. You don't need to do this. This is for the circulation purposes. So with this in mind, I'll stop sharing my screen. So with this in mind, we started this mentorship forum. So now what we have seen in the last 2-3 weeks is instead of a two-way communication with the people or candidates who are pursuing the courses, it remains a push sort of system from the leader faculty already there. Like, we need to push you read this, we need to push that you do this, you need to push that you answer this, but nobody is sharing what they are seeing daily, what went wrong, what went right, how they managed a particular case. So this is something which needs to be there. But before that we discuss on that, I invite those people, those who have joined this, like Akshata from Mangalore, uh, Malud from Myanmar, I think Sunil, Naveen, Reddy. So one by one, you can raise hand and you tell us why you have joined this mentorship program. What are your expectations? So with the discussion, we can implement these in the coming days. So in our days, there was nothing this sort of, but we want that this should become a really handy forum for everyone, those who are doing critical care. You just raise your hand, introduce yourself, tell the expectation, why you joined, and what we can do to help you out more. Yeah, Akshata.
Yeah. Hi, sir. I'm Akshata.
Uh,
So I actually come from an MD anesthesia background. So
okay.
I joined critical care. My DRMD critical care last year. So actually tomorrow will be 1 year since I joined critical care.
Wow.
So when I joined, I noticed the disparity in terms of what we studied in anesthesia and how different it was in critical care, because even during anesthesia, when my during my anesthesia training, I was used to critical care, but it was surgical critical care and neuro critical care. Even then the postings were lesser in duration compared to OT postings.
Okay.
So at that point of time I felt completely lost. My faculty were really good, but the people that I was posted with, they already had experience. So I always had that mindset that okay, I need to study more, but I was having trouble understanding things in the
Okay.
beginning
Mm.
and then retaining things. So whenever used to find any opportunity to learn something, I used to quickly enroll in it. Like I was also part of the pilot Mequent batch also.
Okay.
So whenever there was any opportunity, I used to take it. So my intention is basically I want to learn as much as I can, and I always learn better when somebody teaches me something more than when I read it. So that was my main intention.
So, what sort of things you already told that somebody teaches you, you grasp more. This is one
Yes.
way of. So, what things you feel that till now there is something missing, or something which went well, that this type of teaching helps you more, and something which you need feel somewhere in the mind that this should also be included. One thing, can you tell?
So mainly why I feel it helps me when somebody teaches me is language is always simple. Textbooks are a little more complicated when I read them on my own in
First.
the beginning. But once, in fact, like in the Mequent classes, when you used to show the pages from Pilbeam, and then when I used to read it, I used to understand it better. Initially, it used to seem very complicated to me. So that way, I think that is how it actually helps me more. And because it is a two-way input, as in not just a visual thing, somebody is
Mm.
also reading it or like saying it out loud. So there is a two-way input that's going in. With today's, my attention span is also down because of all the other influences that are there. So that way I think it helps when somebody teaches more rather
So,
than just reading.
just for my curiosity, how long? What is the longest session you have? Uh, means you have seen or attended on the pilot batch.
Sir, to my bad luck, when the ARDS class was done, I had a night shift. And also when the ventilator graphics class was done, I had a night shift. So
So
the
you have
longest classes that were there, I had to watch the recordings. But the other classes I've always attended in full itself. 2 hours I've always attended.
but you have seen the recordings.
I have seen the recordings, but ARDS I was not able to finish in one sitting. I watched it three different split sessions. I had to watch it to finish it.
You have given the mock exam.
Mock I gave, yes, sir. Today I gave it in the morning.
So how was the experience? It is easy.
It is good, sir. I like the experience. Even in terms of the interface was good.
Hmm.
The questions were also nice. I felt happy, confidence boost.
Dr. Sonal designed all those questions.
Thank you, ma'am.
Thank you, Akshita. We'll love to be, remain connected with you. So
Yeah.
two
Thank
more
you, sir.
years you are there in the course, na?
Yes, sir.
Okay, we'll run
Thank
together.
you. Thank you,
Uh,
sir.
anybody else wants to say something? Naveen Reddy, Obul Reddy. Uh,
No, we want everybody should say something.
ah, yeah, Naveen. Please turn on your video. We need to see you.
Good evening,
Yeah.
sir. Good evening, ma'am.
Good evening. Uh,
I'm Naveen Raj. I finished my MBBS and I have been working for 1 year, 5 months in an ICU setting.
yeah.
So when I first joined the ICU, it was really too much as an post MBBS student.
Okay.
So at that time only I came across the ICU channel. So it was very very helpful. Each point that I read in the I saw and learned from the ICU channel, I was able to apply in the ICU itself. So seeing me, my colleagues were also more motivated in learning. So that was really giving me the confidence. So actually, I'm usually I'm very more keen on learning, but there were so many information since I was a post MBBS. There was so many information for me to learn in the ICU,
Hmm.
so it was scattered everywhere. The ICU channel gave me a platform from where I can all the information from there. So from there, you people introduced the MECVEN course. It was very very helpful, and every class I could go and see the ventilators in the ICU, and I started using the ventilators only after I joined the MECVEN course. So it was really helpful. So after the MECVEN course came the this one. So that's why I joined this.
So you are pursuing any course in critical care or fellowship as of now?
No, sir. I'm preparing for my NEET PG exam, sir.
Okay, so something in your application must be reflecting that you are interested in doing critical care. So, at your level, now we have Akshata who has done anesthesia and now she is doing critical care. You are you are here graduation, you are working in the ICU. Maybe in future also you will work in a critical care. So, with this mentorship forum, what are your expectations? That what are the things you feel that this should come from the mentorship forum, which will help you more?
Sir, this mentorship forum, I actually see this as an sir. I am planning to pursue to work in an ICU in the future, sir. So this mentorship forum, along with my postgraduate course, this mentorship forum, I am expecting this to be an additional. I think it should give me the knowledge one step above to my peers, sir.
Okay, okay. Thank you, Naveen.
Thank
Thank
you.
you. Anybody else? Uh, mm, Obul Reddy, Sunil, and Malut. Yeah, Dr. Sunil.
Good evening, sir. Good,
Good
sir, Sonal
evening.
ma'am, and Vivek,
Uh,
sir.
uh,
I'm Sunil. I'm an internal medicine doctor
uh,
from Nepal. Actually, I've been seeing the ICU channel, and when the McBain course came, what I mean is that we have recently set up the ICU in our hospital.
mm,
So, medicine, the ICU is responsibilities fall on the medicine end because we lack the critical care, many critical care specialists over here. So the purpose of joining the Maybank course was to learn about the ventilator, and during that course, I really enjoyed and learned a lot, and gaining more confidence. And when this Make Bent forum came, uh, I applied because I have seen that I have seen that I have learned a lot during the Make Bent course, and on the description of the this forum, like this forum mentorship forum also shows that if we have any doubt, any queries, there will be a guidance. And also I have seen that the discussion that we held in the WhatsApp group of our Megwin course, that also helps, really is helpful. And basically I want to learn more about these things, critical care and ICU. So that was the reason for joining.
so again, I ask the same questions. So everybody wants to learn something. That's why they are in the whether it's a pilot batch or any course or the mentorship forum. But specifically from this mentorship forum, what are your expectation that this is something which I was missing somewhere, and now I can get it from here. So any one expectation which is there, or you can utilize that part of it.
One of the things that since after I joined this my after my MD, whenever we have a doubt, we used to refer to the textbook, and sometimes the searching also will be difficult. So like after I get I started the ICU. We have a lot of problem regarding the management of ventilator or managing the critical care, like management of critical cares, this ionotropes and sepsis also. This critical ill patients. So the what I expect is that after whenever we have a doubt or whenever confusing case, I want to discuss. The purpose was to discuss and find the solutions. So find the solution from the experts like you and other faculty in the mentorship forum. One of the reason was that.
Okay, great. Thank you, Sunil.
Thank
So
you.
we have Saurabh here, we have Obul Reddy also here, and we have Dr. Pankaj also. Saurabh, you want to say something? Why we missed the presentation? Anyway, we'll share the recording. So why you joined this mentorship forum? Tell me something about yourself and what are expectations from the mentorship forum.
Good evening, sir. Good evening, everyone.
Good evening.
Basically, I joined late because I was just finishing my rounds for my night duty.
Okay.
I am Dr. Saurav Sarkar. I'm an MD anesthesia, DNB anesthesia. I've just finished my residency last year, January, and I have joined my DRNB critical care. I'm just a year old into this. I'm just waiting for my juniors to join in. The counselings are getting delayed. But anyway, so my journey with ESBIM and Ankur sir, you have been the face of it. Like I came to know about this entire platform and the website way later, but it basically started from while during my residency, just Googling and YouTubing the doubts that I had regarding critical care, just basic like any topic. I think I still have your how to choose antibiotics, a 54-minute long video still bookmarked on my YouTube video. That video helped me because like I still don't know how to escalate or de-escalate antibiotics in gram negatives, especially very clearly. And then your shorts and YouTube, Instagram reels came up, and then obviously I realized that this is a valuable channel that I need to subscribe. And then it has come to this point where I'm in the membership mentorship forum and making use of it. Also, a very valuable addition to everything else is your book about all the landmark trials.
Thank you.
That is like an easy go-to book that I have visited a number of times, and I probably will be needing that for the rest 2 years of my course and beyond. That is like one like gold mine of a resource. Apart from all the other things, like just getting the gist of it is very helpful. Thank you so much, sir, for that.
Thank you, Saurabh. And just to tell you that Vivek, Dr. Vivek and Sonal, who are there with us also, they are working on the second edition, and it will be out somewhere in the October, November. So we will cover all the trials
And the
in the
last
last
one.
2 years. And not only that, they are changing and modifying and upgrading the format also, so it becomes more helpful in that category.
Right.
So if you people want to contribute to a part of it as a reviewer before releasing it finally, you just drop a mail to, or you can just post on the mentorship group itself. So we can
Definitely,
take
sir.
it there. So we'll guide you there how to do that. Akshata, you can also chip in that if you want to part of that. So we'll be doing that every trial summaries and everything's we'll be reviewing, and then before making it in the final, you want to have a what you want to say, the real case scenario feedback of that
Right, sir.
which we done, that what, as a person who is working in the critical care, so what thing you missed, what thing you liked, or what needs to be modified, like that. So if you people want to be part of it, just chip in and drop a mail or on the mentorship forum, that so that we can create a collaborative group and work on that. Already the work is going on, but we are again, I told you that in August, and there is SITSCon there in August 21st to 23rd in Ahmedabad. So that is we grab that opportunity to unite there. When Sonal is there, Vivek is there, and I will travel. So on that 21st or 22nd, hopefully you will have a that if this landmark trial was a gold mine, something bigger than that is coming. Is our the ICU app. The ICU channel has been there for 6 years, and now the ICU app will come. It will drastically change the way we learn and get support in critical care. So we are working very hard on it. So every night we review it till 2 3 a.m. and then, but I think we will be on the time. We'll be on the time, so we'll be able to do that. So that's why the book was scheduled to be released in the July August, but now it is on the second number. First is the app will come, and it will be roll for iOS and Android. So thank you. It's good to hear when you produce something or try to help out something, and somewhere in the world it is helping somehow. Somehow, I also get a feedback that one of the very prominent faculty that this book is on their desktop every time. They just want to see. They open it and see what was there. Thank you, Saurabh. But one more thing, from this mentorship forum, what is your one thing? If I want to ask you that, what is your expectation from this mentorship forum? That you want at least this should be there in it. So what that thing will be?
Sir, as of now, like the discussions that I've seen from the beginning of the WhatsApp group specifically, I could at least understand how others are thinking. I'm very new to the actual ICU scenario. Like previously, I have worked in an ICU as an RMO or some very brief amount of exposure during my residency in anesthesia. But now I'm in a like completely through and through in an ICU, and I want to know if the way I am thinking is also the way others are thinking, like at least the beginners or people who are like stalwarts or consultants. I don't expect myself to make fancy diagnosis, but I just want to know the thought process of people. And for that, the WhatsApp group is working really well. Like the answers that keep coming sometimes, like I am also thinking in the same line. So I get it. Like, okay, this is right. And probably that is only helping me approach a case in a particular way. Currently being a student, that is all I'm looking for. If there are any seniors who have recently finished their DRNBs or DMs or are still pursuing that in the second year or third year, it would be very helpful, because a lot of the corporate hospitals who are getting the seats of DRNB, they might have seniors or they might not have very strong robust academics in the institute, because most of these are practicing doctors who have just been given so as to say a cheap labor of an RMO to fulfill their ICU work also.
Correct.
Academics is something that is happening in most big institutes, and the lesser institutes are just mostly doing with daily rounds.
Yeah.
So if there are people who can guide you as seniors for an exam also, critical care, obviously that is a lifelong learning process, but just cracking the exam also in the next 2 years or 1 year or 3 months is also a different ball game that we need to address. Also, what I have been hearing, the question pattern is very volatile. They keep changing it very frequently. I basically attended a refresher course a couple of weeks back in Kolkata, Tata Medical Center. Dr. Pralay Ghosh conducted it for the current exam going batch. And I got to know so many different things. I just basically wanted to know how much should I know at the end of 3 years of this course, because I don't have seniors here. So maybe a mentorship for the exam and not just critical care. If there's a small section for that, that would be very helpful, sir.
Okay. So even I can see a potential faculty sitting here, Akshata. She is about to complete first year. So she can help you. So this way, I think this mentorship forum is getting where we are with what purpose to fill the gaps between different institutes, whether small or big, with whether academic, non-academic, means tertiary, tier 2, tier 1, everywhere we can have a common. So one thought when I was listening to you, I think Vivek will also agree with me that in mentorship forum we can have a weekly one case discussion sort of thing. Like suppose you feel that okay, patient of SH came, so everybody know the theory, but how things change practically in your ICU, how we have been seeing that SH patients, what complications they develop, what are the practical things which we need to look at, and manage while managing. So we can take a particular scenario, like suppose a patient of SH comes, so how he or she will present usually. Now once they present what should be immediate priorities, what we should do, the blood pressure targets, whether you go with the oral immunimodipine or IV nimodipine, when will you take a decision to means operate, non-operate, or sort of things. Means it can be anything. It can be aortic dissection, it can be sepsis. How, like very valid point, when to escalate, when to de-escalate, at which point of time you will feel that I will upgrade the antibiotics. So I think we can think of, Sonal, also we can think of having a case discussion specifically for the mentorship group, that
Right.
so we can have a case discussion on a particular topic. Maybe it could be a real case which we are facing. You can also share that this sort of interesting case we discussed, so we can then take on that session, or we can create a pseudo case. Not pseudo case means to start with a scenario typically which we have seen in the past, and then implying the theory plus practical, both ways we can collaborate and can get best out of it. This could be one way of doing it. Like
Yes.
we have a liver transplant patient, and the last, I would say that in the last three, 4 cases, we have seen everything which is written in the textbook as a complication. The point is, how do we manage it? So this is one thing. If you people agree, we can discuss on the WhatsApp group of mentorship forum, and then we can start with that. I think that can be of help somewhere.
Yes, I think it will be helpful.
So we'll structure
But
it.
one thing I would like to suggest is that once we start discussing a case, no, everybody should pitch in with whatever ideas they feel, whether it's right or wrong. Because what we see is there are a lot of hesitations when we start discussing a case. Nobody starts commenting whatever they think. It's okay. This is not a judgmental thing which we are discussing about. Even if you are wrong, everybody is here for learning purpose. And we all learn from our mistakes. Even we have gone through the same phase.
We are
So it
still
doesn't matter.
uh,
It doesn't matter at whatever stage of life you are or we are at. Everybody is there to help each other. So that is what the purpose of this meeting today was, that everybody has become very passive in the case discussions. That
No, I
even
think
if we
case discussion should be online. It can't be done on the WhatsApp. We need to have a visuals of everybody here who
Yeah,
take part in it.
because on WhatsApp, once anybody puts a case, for example, if Dr. Vivek puts a case, or if Dr. Ankur puts a case, I put a case, or even if you want to put a case or discuss something, I have not seen anybody, actively pitching in and, answering that, okay, this is what I feel. So until unless it doesn't come from you, there's no point, we put a case and then we answer, okay, this will be the, point 1, point 2, point 3. I mean, I don't think it will be helpful to anybody of that sort.
So I'll give you an example. Like suppose a patient of stroke you are handling, है ना? On the ventilator now you find that the sodium is 163. Okay, fine. So first thing you feel that sodium high means the water balance in the patient is free water balance is low. So we need to bring down sodium to somewhere around 150, 145, 150. So there are two ways. One will say that one consultant will say that you start free water through NG tube. Other will say switch the NS to half NS or switch the NS to half DNS sort of thing. So what's your practice? What you are doing? What are the plus and minus of doing that? What the text said? So I'm very much sure that whatever I have said, it must be practiced in certain number of ICUs. Some may be using free water through NG tube only. Some may be using DNS. Some may be using half saline. Everybody is doing it. Patient gets well also. But what is written in the text? What should we go? What is the logic behind it? How it should be practiced? But it should come from you that we are doing this. I would have done this. At least not we. I would have done this if that I was in their place. Because over a period of 2-3 years later, you will be independent consultants. You will be teaching your fellow members. So you need to commit to something that, okay, if I was there, I would have done this with whatever I have read. So let's see if this is correct or we need to modify it. So that way of interaction, I think, should be done, and it can be done beautifully either in a physical meet or at least in a virtual meet. It can't be done on a WhatsApp group, I think, but on WhatsApp we can write that this week we can have a discussion on this type of case scenarios, like that. What antifungals needs to be added, for which antifungal will cover what, where we need to switch into M4, where we switch into Anidula, where we switch into voriconazole or itraconazole, something like this. We need to have case scenario and discussion. So thank you, Saurabh, for your inputs. I see. So, yeah, who's there? Yeah, Obul.
Yes, sir. Good evening, sir. Myself, Opal Reddy.
Uh,
I completed my internship 3 years back.
okay.
I get to know about. I am thinking of joining any like critical care courses. I get to know about F3CM from you only.
Okay.
So I want to know how to think, how to manage the patients, like that. Like Saurav sir said, I want to know about what others are thinking, how to manage the case.
Mm.
I want to learn as much as possible from your side, like that.
So you have enrolled for FCCM as of now?
Yes, sir.
Okay. So you are in the current batch.
Yes, sir.
Okay, great. So okay. So what one thing you feel that other than what we have discussed, like Saurabh we have discussed, Akshita we
All,
have discussed.
all
So
the
what?
points specifically.
Huh?
All the points I was
All the
thinking.
all the points they have covered.
Yes, sir.
Okay. ठीक है. Where are you from? Where are you from?
Like I'm working in Telangana, Hyderabad, from Siddipet, nearby Hyderabad, sir.
Okay. Okay. Thank you. Thank you.
Yes, sir.
And thanks for your mail. Our technical team, you were able to fix a bug for us. So it was a bug in the system where if registrations are closed on 16th, if we open it, it was not getting opened for the members. So because of you, we were able to fix the bug in the system. Thank you. Thank you for that.
Thank you, sir.
So Dr. Pankaj is also, Vivek will welcome Dr. Pankaj. He is very fan of yours.
Dr. Pankaj ji, can I see your face? Yes, sir. Good evening.
Good evening, everybody. Sorry for joining late. I was stuck in the traffic. This is a very
No,
difficult
but
time
we
in
know,
Dubai.
Dr. Pankaj, we know, though you are late, though you are not present also in video, but you are there with us always.
Yeah, always 100%. So, sir, I want to tell you something that although I may not be having that type of knowledge as you all, but still I want I think a case discussion should be not only the clinical, but starting from pathophysiology and then pharmacology, discussing why we are taking, starting some antibiotic and why we are putting another combination, why this is, this antibiotic is not necessary or why it is contraindicated, or for example, pathophysiology of organism or, multi-organ dysfunction, whatever. So, starting from pathophysiology, and then maybe when somebody is presenting a case, the clinical case, somebody else can be ready with the pathophysiology related to that topic, and somebody else can be ready with pharmacology. And because we will only be discussing clinical things, and which many people they try. As far as I am concerned, the place where I am working, this is not a very high volume ICU, and the decision making is in somebody else's hands. So whatever the decision is made, we cannot question, we cannot ask them. I am anesthetist and I am not a critical care specialist here. So here the distinction is very, much clear. I mean, you cannot interfere in, so like that. So if we go deep into the discussions, then I think we will be covering all the aspects: pathophysiology, pharmacology, clinical outcomes and scenarios, and how we can improve and what is the latest available. So that is my opinion.
Just want to show you, Dr. Pankaj, what you have said. I want to show you something which is on the lines also, which is our very, I would say, vision. You hope you people are able to see my screen.
Yeah, I can say.
So, as you can see, we have already, you people know about this MACMENT course, which is pilot is over and the pilot means exam is pending. But what you can see here, the July batch is coming. Now we have 6 courses lined up for everyone. 2 of them are not mentioned here, but you see, one is your clinical papers, how to read and understand clinical paper, because this is something I think there is a gap. We, I would, I would accept that when I used to read clinical papers initially, I was very scared of them. When somebody on rounds used to discuss a particular paper, okay, no, the new trial has come and we should not use triple S therapy and SAH. So I was thinking, okay, no, new trial has come, we should not use the triple S therapy and SAH. Something so a trial has come which has shown no difference whether early tracheostomy or late tracheostomy. So at whatever time you do it, it's okay. So these sort of things I used to read, I used to listen. That's all abstract. I used to read it. But the more and more time I spend in critical care, I think reading clinical papers is a skill which everybody should master.
Absolutely right.
This is something we should be taught in the graduation. Unfortunately, because of the all the books and subjects there, this gets something which is at the back seat. But I think understanding critical care, reading and understanding critical care papers, it's something which is we should master it. What they were trying to find out, what sample they collected, what were the exclusion criteria, what were the primary endpoint, what were the secondary endpoint, okay, what result they could do, what were the post hoc analyses. So what this paper actually tells you about it. So how we can apply this paper at my patient bedside. So this way, one develops a great confidence in conversation, discussions, debate, and also at applying at the patient bedside. This is the first step. Once you start reading clinical papers, you will automatically move to research. The more and more you start reading clinical papers, the more and more you feel that now it's time for me to this problem nobody has solved. I will take a thesis on this. I will try study on this. I will do a survey on this. So this is our second thing which is coming in. Then the one other course which we are very much working on it's the art of bedside clinical examination, which is a very close course, which is all the prices which you are seeing here are the dummy prices which are at the back end. So bedside clinical examination specifically in critical care. So we have lots and lots of textbooks and very good clinical books which teach you how to examine patient at the OPD, at the wards. But the clinical examination in ICU, people do it to a certain extent, but it more or rely on the technology. You have monitors there, you have ventilators there, you have different labs are there, blood gas are there. So bedside clinical examination, nobody teaches you how to do in a patient who is critically ill on the bed, can't communicate, can't turn around, the physiology deranged, the patient is having anasarca, illicit signs is difficult. So we are coming up with how to do a clinical examination in critical care. Then what you were telling, Dr. Pankaj, that we should discuss the pathophysiology of things. So for discussing the pathology, you should understand the physiology actually. So
Correct.
applied physiology means first you need to understand what is the physiology of the patient, and in ICU actually we are trying to reverse the physiology only. The physiology get deranged and we are bringing back. That comes to our point that deranged physiology is also one of the very good side on the concept. The idea is deranged physiology. In critical care is the physiology which gets deranged. So applied physiology in intensive care means, like you suppose you interpret a thyroid report, thyroid profile report in intensive care. So what does this mean? Lactate levels you are understanding, but what is the pathophysiology of lactates which can be applied in this patient? PCT, procalcitonin. Everybody thinks of PCT, but where it is getting originated, which condition it will pseudo originate, what decision I have to base it. But for that, you need to understand the physiology of what is happening. That's something I think we should we understand. Then we have not listed here. We are coming up with a specifically designed course for nursing critical care. I think which is very, very important. They are something which we need to be. I think we should. It's an onus on us that we should teach them because they are the heart of any ICU. So what you're saying is absolutely very relevant, and yes,
Yeah.
while case,
So,
I think we should also
for
focus on physiology and pathophysiology.
yeah, for this physiology part, actually, this is what I meant. Until unless we understand the physiology, exact physiology, we cannot understand the pathophysiology, and we cannot know how to correct it. If we don't know this, then we just follow the people who say that I do this, you do also do this. And so that is not the right thing. As far as the physiology teaching is concerned, I can volunteer myself. I can contribute somehow in physiology teaching or pathophysiology teaching. I am very fond of that.
Thank you. So Sonal, please take sir's name in that. We can take help of him. And
Yeah, sure.
Sure,
so,
sure.
so
Anytime.
Thank you.
those who don't know, Dr. Pankaj is associated with us for ESBICM for way long. I was fortunate enough to meet him at one of the critical care exams, and then he was a very regular member of the pilot batch. Those who are in the pilot batch must have known him and his passion for learning. And now he's in the mentorship group forum. And now currently you see he will be a contributor also to some of the sessions. So this is how what we want, that people should come forward, discuss, have developed that confidence, that there is a platform which can provide all these things here, and it's a family sort of environment, which is, I think, which we are missing when we are doing our fellowships and critical.
Also, sir, I want to say one thing
Mm.
in Dr. Vivek's style.
Yes,
And
please.
that is what the teacher, we think the teacher is teaching. Actually, the teacher is learning.
Yes, absolutely
Isn't
correct.
it, Dr. Vivek? Isn't it like that?
Yes, obviously.
Teacher is actually learning more than the students.
Yeah,
Absolutely right.
So
yes,
this is what I want to do.
yeah. So
Thank you.
thank you. Now, who else left? Well, I think this is Dev is also there, na? Anybody wants to introduce themselves, say about this mentorship forum, what your expectation? Those who joined late also there. Anybody who left out, please raise your hands. We would love to hear from you.
Yes, hi, I'm from Calcutta.
Can we see your face?
He has muted himself. We want you to see you. Okay.
Dr. Dev, we wanted to see your face. You have muted your voice also. I
Maybe
think
he'll come back in a while.
maybe there is a technical glitch.
Yeah. Then Malut is here.
Uh,
Yeah, I'm just grateful and
Am I audible?
yes.
Yeah,
Yes,
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 yes.
So, so this is an excellent platform and it is really helping us who are new to critical care. And like I said, it was Ankush sir's ICU channel which got me interested in critical care learning from scratch.
Mm.
So this mentorship is, very important for us who practice in tier 2, tier 3 setups. Like we are resource limited, not a very big institution. And I enrolled for the McVin class and looking forward to learn from the basics because the clearing the concept is very important while approaching. We have very big, heavy textbooks, but focusing on the basics is what I personally feel will actually help us in dealing with in such a complex subject like critical care.
Very nice. Where are you from, Dev?
I'm from Kolkata, sir.
Kolkata.
Proper Calcutta or nearby
So,
town?
I practice in the Howrah area, this side of
Okay.
the river.
Okay.
Okay.
So that's it.
Thank you. Thank you. Very nice. Malut, yes, you were saying something.
I'm just grateful. I'm let's say all originally from Myanmar, currently working in Brunei Darussalam as medical officer at a intensive care unit. For me, yeah, I would like to grow and learn from ESBIC until I am recognized as intensivist. So please tag along with me in each course, the coming course. So I'm very excited to learn from Dr. Pankaj on the future course. So yeah, my anticipation is to attend every course from ESBICM. So uh,
Thank you.
currently that's all I want.
Thank you, Malut. So those who don't know, Malut is also being there with us for a very long period of time. He was a member of the pilot batch. He was giving, will be giving his exam, and he was one of the few members who came forward to give their feedback for ESBICM in a video format, not even before the pilot batch. That's correct. That's how I remember his face. And now he is a very familiar part of the family.
Okay, thank you very much.
Thank you.
Yeah, thank you very much all.
Anybody left? I think Vivek. Anybody left?
No,
No.
I think we have covered.
Yes, there are lots of people. Atul Das is there. Then
Recently,
Abdi
I think they have
Rahman.
joined. Abdil and Atul.
So those who haven't talked, we had a small presentation of 10-15 minutes. What is Mentorship Forum about? And now we want that you people raise your hand and say something about yourself and how you feel this mentorship going forum. What are your expectations from it? So just we can get to know each other. Atul.
Hi, sir. Actually, I'm house surgeon right now at Government Medical College, Thrissur.
Okay.
Yeah, so I've always been interested in critical care from my house surgery, even from my final year onwards. I had an elective posting during third year at medicine ICU at our college, where I was able to assist in a lot of things. So from there, my interest started. So I thought this would be a great platform for me to learn more about,
Okay.
intensive care.
So you will be doing some critical care courses, or you are planning to enroll for that?
Yeah.
Okay.
That's the plan.
Right. Thank you. So I think that's all. These many people joined. So this was the opening meeting. And to be sure that all the meetings or links will be there on the membership panel, member panel, and from August, after August, it will become very easy for you to get the links on the app. So as of now, it can be two means at two places you need to be take care. One is your live classes, and the other one is the event. So this was one event, but most of the time we'll have a live classes specifically for you people. So make sure you join them. We'll put that info on the WhatsApp group also, that we will discuss this. And so we have noted down that we need to have a case discussion sort of thing. How we will figure out so that it can remain sustainable. The program remains not break in between. How we can plan the case discussions. We don't want in a very formal manner, but we want in a deep manner, interactive manner, where once we discuss as a case, like if a myasthenic crisis patients come to our intensive care. So after that case discussion, we need to be very sure, we need to be very confident, okay, these are the things we need to do. These are the things we need to anticipate, and these are the things we need to be prepared with and counsel the family that these are the things can happen. So in that way, we need to discuss those cases. So I think we all will learn together. Before ending, I will invite Dr. Vivek to have a few words, and then Dr. Sonal.
So, thank you everyone. And whatever we have just discussed, that please take participate, take part in all the discussion. It motivates all of us. It motivates you, it motivates others, your colleagues who are there in the mentorship forum. It motivates us also. So it's always good to have discussion. You may be wrong, right? You may be wrong, but it's okay to do a mistake in your discussion. It's very fine. Nobody's perfect in this world. Not me, not Dr. Ankur Gupta, not Dr. Sonal. Nobody's perfect. We all are learning each and every day from our cases, from our patients, right? We do learn from you people also. So it's okay. There is nothing, to shy about that. What will I do if my answer is wrong? It's fine. The only thing is do participate, ask questions, put cases, whatever you have right now in your ICU. So by doing this, we can modify or we can just add on the overall, keep continuing the discussions in our group mentorship forum.
So like in front of the patient, you need to have some decision, na? Whether you will take that, whether you will give IVIG or whether you will do a plasmapheresis, whether you will do a dialysis right now, you will wait for at the patient bedside, you will take one decision. So posting in a WhatsApp group, posting in our discussion forum is way simpler than taking a decision at the patient bedside. It's better to post there. And I request each one of you, those who have attended this today's session, please post a little bit, 3-4 lines about this meeting, your feedback on the mentorship forum group, so that others who have not joined, others who have missed, they will also get motivated to join this in the next sessions. Yeah, Dr. Sonal.
Yeah. Hi, good evening, everyone. So I think Dr. Ankur and Dr. Vivek has already summed up. And this forum is for all of you. And we are also learning with you. You are also learning with us. So the reason why we have formed this group of people is for a two-way communication. So definitely we will be sharing cases. We would love that you should also share cases with us so that it's a good group discussion, and it's like a closed family of people where we should not feel, hesitating about discussing anything or everything. So even if we are wrong, nobody is judgmental about it. It's good that we learn from each other's mistakes, as I already mentioned earlier. So feel free to talk about anything and everything, whatever is happening in your ICU. If you feel, even if you feel that this was a decision which I took was wrong today, you can always come back and discuss, okay, this is what I did, what this was supposed to be done. I think whether I'm right, I'm wrong. Sometimes you read something in books which is not done in a proper way and you think this is how it has to be done. So there has to be reasons for sometimes, consultants have different reasons for something. So always come back, feel free to discuss. Don't feel, we have 100 people, so what they will think, what, they will think. There's nothing like what people will think in this world. Always think about, okay, this is what I have to learn at this point of time. So for us also, it is an opportunity to learn with you, because at our time when we were doing our post-graduation, we didn't have any platform like this. So that is how we decided that we should give a platform to you. So make, a good use of it, use it completely, use it wisely.
So one more request to all of you, because it's an opening session. So not every session of ours will be available online, but because this is an opening session, so it will go on the YouTube also. So I request all of you to at least put on your videos so that people will see you, that you were part in the opening session of the mentorship forum. So everybody can put on with their video and say hi to them, those who are viewing it. They can just say a few words that come join the mentorship forum sort of thing, message you people can give. If you are pursuing any sort of critical care course, you can join this. You can apply. So Dr. Pankaj is there, Dr. Atul is there, Malut is there, Dr. Dev is there. Obul has switched off his video. Akshata is there, and Saurav,
yeah.
Saurav, all these people are there. So it's good to have you on the screen. And please post your feedback regarding this online meeting on the forum WhatsApp group. And from August, I think we will be switching back to switching to the dedicated app. There is a chat feature will be in there, so we'll have a better conversation there. So it will be better than WhatsApp, what is there on the WhatsApp as of now. So with that, we close it, and we'll whatever we have noted down, we'll have a continuous discussion on the WhatsApp group as of now.
So
Okay.
can we just take a screenshot of everyone here?
Acha, yeah.
We can do that and post on
Good
the group
idea.
rather than putting everyone else.
Good idea.
So Akshata,
Good idea.
Akshata, you should also come here. You are entering the second year. This is a good way to do this.
All of them should switch on their videos.
4 people have not switched on their camera.
Who is taking screenshot?
I took.
No, you took already.
Obul,
Thank you.
Reddy, I think they got busy. I'll take one more. So everybody should have a smiling. So Atul, smile कर यार. ठीक है. चलो.
Thank
Good
you,
to see
everyone.
you
Good
guys.
night.
Thank you.
Thank you.
Yeah, good night.
Bye.
Thank you so much, sir. Thank you so much.
Thank
Good
you.
night, everyone.
Good
Thank you,
night.
man.
Thank you.
Good night.
Oh,
Hey,
Akshata
रुको,
has
just
come.
stop. Akshata has come. I'll fix it there. थोड़ा सा camera, you need to be a little like that. Thank you.
Where's Dr. Vivek?
I'll fix it that in that. Okay. Somebody else is there. Muhammad
Abdi Rahman.
Abdi Rahman. Yeah, where are you from? Can you just unmute and let us know about yourself?
Yes, I am from Somalia.
Okay. Just let us know about yourself and how did you came to know about us and what are your expectations from us?
I am from Somalia. My name is Abdurrahman Mahamad. I am an anesthesiologist. I am not critical care specialist, but I am junior anesthesiologist.
Okay.
Am I audible?
Yeah, audible. Little voice breaking, but we could make it out. You have an anesthesia background.
Yeah, I am an anesthesiologist. At the moment, I am working for Somalia, especially the eastern part. And at the moment, I am anesthetic, but I'm long time follower in ESBICM. And thank you, Dr. Kumar, and all of the faculties and the members. And I wish the best. And I learn more things. I'm not confident, but I I study for many things.
Okay. ठीक है. Thank you.